Kaki Watson. So breathing is an essential aspect of our day. We do this every day and it's also important for us to have a healthy lung. But do we really know what is a healthy lung and what can cause damages to our lung? So for this discussion, we shall have Dr. Nara from Pantai Hospital to help us with this topic. Hi Dr. Nara.
Hi.
It's great to have you here.
Thank you, it's a pleasure.
Alright, so for lungs, I think it would be great for the audience if you could brief us the importance of lung and how you would define a healthy lung.
Lung plays a major role in gas exchange in human body. Whenever we breathe in air, the air that we breathe will be transferred into the trachea, to the bronchus and to the alveoli in the lungs, and the blood in our heart will be transported to the lung, and mostly the used blood contains high level of carbon dioxide and then it will be exchanged in the alveoli with the oxygen. So your body will be replenished with fresh oxygen from the surrounding air and the carbon dioxide will be secreted. In order for this exchange to take place, a lung plays a major role.
So how would you define a healthy lung?
Definition of healthy lung varies, but mostly for the public is a person can carry on with the activity of daily living without any limitation, without having breathlessness, then they have a healthy lung.
I see. So as a thoracic surgeon, what kind of lung damages have you seen and what are the common causes?
As a thoracic surgeon, I've seen many types of lung damages, mainly lung cancers, lung infections like empyema thoracis, whereby the lung is covered by abscess within the lung itself. The one that is quite common among cigarette smokers, what we call as Buller's disease of the lung.
So as you mentioned before, can you say that smoking is actually one of the main causes for lung damage?
You're very right. Cigarette smoking is actually cause for most of the lung diseases that I just mentioned. Like for example, cigarette smoking is directly attributed to lung cancer. The Buller's disease of the lung is directly due to cigarette smoking. It destroys the lung tissue and transforms it into a balloon-like damage which can rupture and cause air trapping in the thoracic cavity. Lung abscess can also be attributed to cigarette smoking, which leads to easily infected lung tissues and leading to lung abscess. So cigarette smoking is attributed to almost any types of lung disease that you can think of.
If there's like so many causes of damage that smoking can cause, why do you think people still tend to grab a cigarette and smoke?
Well, I believe that it's a fashion statement that most like to make, especially when they are with their friends. The peer pressure induced cigarette smoking will be converted to addiction, and then when their friends are all away, they are stuck with the cigarette and they continue smoking for many years, and this will directly lead to the damages caused by cigarette. The individuals are aware that cigarette is bad for their health, but they just can't stop it because the addiction is quite severe, and this is the reason why they continue smoking.
I see. So how about vaping? Because I believe that everyday occurrence we will see people going out and vape. Do you think vaping can also trigger all these lung damages, and is it as bad as smoking?
The idea was that in order to stop cigarette smoking, you should move to vaping. But we've learned over time that vaping is actually more dangerous than cigarette smoking, and because it has got more chemicals in it and it can cause lung damage like popcorn lungs, and the damage that caused by vaping to the lung tissue sometimes is even faster than cigarette smoking. So vaping is not actually an alternative to stop cigarette smoking. It's actually more dangerous than cigarette smoking itself.
I see. But there are like some people, they encounter older generation who has been smoking for some time, but they do not have like any of these symptoms of lung damage. They don't have those chronic cough like normal smokers have. So what do you think is the reason for that?
Well, that's a very valid question. I've had uncle and aunties coming to my clinic claiming that I've been smoking since I was 12 years old and I'm 70, 80 years old now, and I'm still healthy. I can still take my grandchildren for a walk in the park. Why should I go for a lung scan? Why should I worry about lung cancer? So what I tell them is that cigarette smoking affects individuals differently. If I smoke cigarette, I may fall ill in 5 years down the line, but when the uncle and auntie smoke, they may not fall ill until they are 70, 80, but the effects of cigarette smoking to the lung has already taken place and it's just transitioning slowly in these individuals.
Yeah, I understand. There's also, we have to take account of secondhand smoke, right?
Very true. Especially if you have small children or your spouse at home who don't smoke and you smoke in front of them. It's actually quite selfish to do so because the cigarette has got filters, and when you inhale the smoke, it is filtered and to a certain extent safer as compared to the secondhand smoke that is exhaled by the smoker. And the secondhand smoke is inhaled by the individuals around the smoker unfiltered. And there's also third-hand smoke, whereby when you smoke cigarette, the cigarette smokes get sedimented on surfaces, and when your children touch the surface, they are affected by it as well.
Yeah, that's true.
Yeah.
So, do you have any encouragement for people out there, smokers out there, who are aware of the risk the smoking can cause to them, to their damage to the family?
First of all, to all the smokers, you need to make your calculation how much you are spending for a box of cigarette a day and how much you're using it for a month as compared to what you actually need to provide your family. Most of the public in Malaysia are within the B40 and the M40 group, and the amount of money you're spending on cigarette smoking is quite substantial, and you may neglect the needs of your family just because you need to spend on cigarettes. So that is one of the main reasons why you should stop smoking. The second reason is if you want to stop smoking, there are many smoking cessation clinics provided. The smoking cessation clinic will be conducted by a doctor who will advise you on how to stop smoking gradually, and they will have steps and measures that will be told to you when you visit them.
So, Dr. Nara, if a smoker wish to stop smoking, how long should the therapy go? How fast can they see an improvement for their tobacco craving?
Well, it depends on the individual and the amount of cigarette that the person has been smoking. So it varies. As long as they take the first step to approach for help to quit smoking, that's a very good start. And how long they'll take, it doesn't matter, as long as they reduce the number of cigarettes they smoke over the period of time. But usually within the first 3 months, they should see the impact of smoking cessation intervention in these individuals.
So, if a person stops smoking for at least a day or a week or a month, what sort of improvement to their quality of life would they see?
When you smoke cigarette, the cilia, which is the finger-like projection from the airway, is damaged, and that will prevent the phlegm to be excreted out from the inner lung to the airway, and you spit it out as your phlegm. So when this mechanism is damaged, the person, the smoker, will have difficulty in excreting the phlegm. When they stop smoking, this cilia will be regenerated normally within the next 2 weeks and above. And if more than 6 months of cigarette smoking, the effort tolerance for the patient will improve close to about 50% to how it was before he was smoking. And when you carry on not smoking any cigarette for the 1 year or so, you can expect the functional effect of the individual to improve tremendously. You may not reach 100%, but it will be way better than how when he was still smoking. The most important move is the first step to stop cigarette smoking, and then the subsequent effects of smoking cessation will fall through as long as you maintain your prohibition to cigarettes.
So, Doctor, in Pantai, is there a specific time slot for the smoking cessation program?
Yes, as I mentioned earlier, the smoking cessation clinic is conducted in Pantai Hospital Kuala Lumpur, a health screening center. It's normally open from Monday to Fridays, 2 to 4 p.m. So anyone just can walk in and meet the consultant to get the advice on how to stop smoking.
So thank you, Dr. Nara, for a very thorough discussion regarding lung health. So for smokers out there who are interested in getting a smoking cessation program and enrolling in nicotine replacement therapy, you can go to Pantai Hospital or nearby medical center as well. Or you can also go to pharmacy. There are also available nicotine replacement therapy that is readily available over the counter. So until we meet again, bye-bye.